Impact of transmural plastic stent on recurrence of pancreatic fluid collection after metal stent removal in disconnected pancreatic duct, a randomized controlled trial. Introduction. Endoscopic ultrasound, EUS, guided drainage is preferred over surgery or interventional radiology-assisted drainage procedures for the management of walled-off necrosis, WON. Dedicated large-caliber metal stents, LCMSs, are increasingly being utilized for the management of WON. Although recent evidence indicates similar efficacy between metal and plastic stents, LCMSs provide wide cystoenteric communication, and endoscopic necrosectomy is easier with LCMSs. Therefore, LCMSs are preferred over plastic stents for drainage in patients with WON. However, concerns regarding recurrence of pancreatic fluid collections after the removal of metal stents remain unaddressed. Disconnected pancreatic duct, defined as loss of continuity of the pancreatic duct, with isolation of viable upstream parenchyma, has been implicated as one of the major determinants for the development of recurrent pancreatic fluid collections after the removal of stents. Disconnected pancreatic duct is commonly observed in patients with WON, suggesting that a substantial proportion may be predisposed to recurrent pancreatic fluid collections after the removal of LCMSs. Indwelling plastic stents have been shown to reduce the recurrence of pancreatic fluid collections, especially in the presence of disconnected pancreatic duct. Unlike plastic stents, which can be kept in situ for a long duration, early removal of LCMSs is advocated to mitigate the risk of adverse events such as bleeding and buried stent syndrome. In such a scenario, the replacement of an LCMS with one or more transmural plastic stents may potentially prevent the recurrence of a pancreatic fluid collection. In this study, Chavan et al. Aimed to compare the effect of replacing an LCMS with a plastic transmural stent versus no plastic stent on the incidence of recurrent pancreatic fluid collections in patients with disconnected pancreatic duct after resolution of WON. Methods. Consecutive patients with WON who underwent endoscopic ultrasound, EUS guided drainage with LCMS between September 2017 and March 2020 were screened for eligibility. At LCMS removal, 4 weeks after drainage, patients with disconnected pancreatic duct were randomized to plastic stent or no stent groups. The primary outcome was incidence of recurrent pancreatic fluid collections at 3 months. Secondary outcomes were technical success of plastic stent deployment, adverse events, stent migration, and recurrence of pancreatic fluid collections at 6 and 12 months. Results. 236 patients with WON underwent EUS-guided drainage using LCMS, and 104 with disconnected pancreatic duct, of whom 94 were males and who had a median age of 34 years, were randomized into stenting and no stenting groups. Both groups included 52 patients. Plastic stent deployment was successful in 88.5%. Migration occurred in 19.2% at median follow-up of 8 months. Recurrent pancreatic fluid collections occurred in 6 patients at 3 months, 3 with stent, 3 without stent. There was no significant difference in pancreatic fluid collection recurrence between the 2 groups at 3, 6, and 12 months. Reintervention was required in 7 patients with recurrent pancreatic fluid collections, with no significant difference between the 2 groups. Conclusion. In patients with WON and disconnected pancreatic duct, deployment of plastic stents after LCMS removal did not reduce recurrence of pancreatic fluid collections.